My name is Nancy Swanson. I'm the Executive Director of the Link Foundation. We're a private foundation based in California, and we're working to improve the health and economic self-reliance of women and their families in Latin America and the United States. We've always just held the belief that health is a human right, and we see the intersection between health and poverty, and if a woman or someone in her family gets sick, she gets poor, it's a vicious cycle. And we've seen innovations, we've kind of looked across the map of the landscaping social enterprise sector, and we've been at this for about 12 years seeing, there wasn't a lot of social enterprises. I mean, it was kind of evolving when we started, and then we found some models that looked promising, both kind of for-profit models and nonprofits, and saw that there's a potential to use impact investing, particularly in the areas of earlier stage investing for healthcare enterprises. So it's been a passion of ours, and we hope to do more in women's health, particularly in Latin America. When we started the foundation, we felt like a life is a life wherever we are, and the market-based approaches in impact investing was relatively new. And Latin America was relatively close, and we really wanted to learn from our partners on the ground that were making a difference. So we chose a geography which is huge. So that was just, and we had aspirations that we could really partner alongside of the organizations we were going to support and companies we were going to support. So we wanted to be close to the work. And I'm sorry, I forgot the...
female population.
And female, the marginalization of women. Our whole goal was to get more women's voices at the table in a leadership capacity, and starting with vulnerable, those populations that are just completely off the grid. And we know with microfinance, which is one of the strategies that we've utilized in our portfolio, that when women have an opportunity with access to financial services and other services, their lives change. And so we've just always seen it as they are the leverage point for their families, for themselves, and for their communities. Clínicas del Azúcar is an incredible organization that we supported, I guess 4 years ago. And we helped them with debt financing early stage when they needed it for growth of their clinics. We supported debt for two clinics that have now opened, and they have reached, I think they're over 15 or 16 clinics now. And we also provided a grant that allowed them to innovate around their business model. They had an idea for a call center, hiring women patients to reach out to other patients, to create more adherence to the program, and also to really understand the needs of their patients. And it's now part of their business model. So they've grown, and they are handling and reaching out to all their patient clients, which are their patients, which are about 60,000, I think, now. So they were a great partner for us to use kind of their early stage capital in their moment of growth. And with Reina Madre as a new partner of ours and a partner to the Innovations in Healthcare as well. And we funded their first clinic with debt financing that opened up in Mexico City. I just saw it a few months ago. So it's their clinic they're partnering with private healthcare hospitals in Mexico, but we were able to took their first financing from us as a portion of their financing to open their first clinic in Mexico City. I would just say Innovations in Healthcare has been really our go-to network for finding incredible entrepreneurs that are making a difference. We've just been able to, we align so closely with we have the same criteria that the Innovations in Healthcare have from a portfolio side in finding those organizations, and we're grateful to be doing that work in the world to identify and then support. And we know within that network of innovators that there's a lot of peer-to-peer learning, and we've found value out. I would say that with Reina Madre, just as a closing example, they called Clínicas del Azúcar to learn about their call center, and I just saw the call center. I was just in Mexico City a few weeks ago to see both the clinic, which also is housing their call center. So they're learning. We know that this incredible learning, especially in healthcare models, is just so critical. So we're appreciative to what the Innovations in Healthcare brings to the entrepreneurs that are making it happen on the ground.